Authorities in Kisoro district have commenced the construction of a 40-bed capacity isolation unit at Kisoro Hospital in Kisoro municipality with a total investment of 4.12 billion Ugandan shillings. The official handover of the construction project to Kigezi Uganda Limited took place in Kisoro municipality. For years, Kisoro Hospital has grappled with the challenge of lacking an isolation center. The construction's official handover was presided over by the State Minister of Defense, also serving as the Kisoro Woman Member of Parliament, Honorable Sarah Mateke. Dr. Emmanuel Bahan, the medical superintendent of Kisoro Hospital, highlighted the facility's need for an isolation unit given its role in treating patients with infectious diseases from neighboring countries such as Rwanda and the Democratic Republic of Congo. The new unit will serve as a dedicated space for managing such cases.
Project, we welcome it because for all along we've been suffering. In 2018, we had an outbreak of Ebola, whereby we used to get suspects and we would take them to Kigezi. The resources were limited, and again in 2020, 2021, we were hit by COVID-19. We didn't have an isolation ward. We would get cases and then take to Kigezi. The district has TB cases, as you know. When you TB cases, you remember the outbreak that happens in the transit center in Nyakabande, also Muramba. So we have history of these epidemics. So this project has come to rescue us. With this facility, it's a standard one. We shall be able to manage those cases effectively. In the whole of Western region, this is the only state-of-art isolation ward that has all the components. It has a theater, it also has admission, the donning and doffing zone. Then it has warehouses. It's a big component of a standard isolation ward.
Engineer Peter Nkurununji, the director of Kigezi Uganda Limited, provided insights into the project's timeline, estimating completion within 1 year. Despite encountering challenges like the arduous lock excavation during the initial phases, Nkurununji noted that they have made significant progress, reaching 43% completion. He attributed this progress to the adaptability under the new governmental system.
As we do the groundbreaking for the construction of isolation center at Kisoro Hospital under Ministry of Health, the project contract sum is 4.12 billion Uganda shillings, and it's supposed to take a period of 1 year. We started in late December, but because government has started changing the mode of groundbreaking, whereby after giving the contractor, they have to wait some work to take place before they come for groundbreaking. A case in point, there was a project the minister gave to the contractor. After 7 months, nothing had taken place. But for us as Kigezi Uganda Limited, we are so grateful. Always, whenever we are given a project, we start immediately.
In her remarks as the chief guest, State Minister for Defense and Veteran Affairs, Sarah Mateke, expressed optimism about the isolation center's role in enhancing the district's readiness for contagious illnesses.
The facility will not only enhance the quality of healthcare services, but also expand the scope of treatments available to our community. Moreover, the isolation unit stands as a testament to our preparedness and resilience in the face of health crisis. In an era marked by global pandemics and infectious diseases, having a dedicated facility for isolation and containment is indispensable. It provides a safe and controlled environment for managing contagious illnesses, safeguarding both patients and healthcare workers. But beyond its tangible benefits, today's groundbreaking symbolizes something greater. It symbolizes unity, collaboration, and progress.
She urged stakeholders to ensure diligent monitoring and supervision of the project to ensure its timely and effective completion.
So to the Kisoro local government, I call upon you to give all the support to the contractor and ensure that the timely delivery of the facility at the very earliest. Kindly remember that lack of quality health services to any one of us is lack of quality services to all of us. Our determination is to ensure that the health services are not only accessible and affordable, but also of quality. I wish the contractor the best.
This is your project. In addition to the team that we have here supervising the project, we have a consultant already employed, and the consultant is coming with a clerk of works that is going to be on the ground to ensure that we get the right quality for this project. This is an isolation facility that is for highly infectious diseases.
This story was compiled by Norbert Ndiamhachi for Kigezi Television.